Gen Z is a big focus for public sector workforce because, the older level of Gen Z is in their mid-20s right now. So these are people kind of primed to enter into the public sector workforce because Gen Z really cares.
And Gen Z has a lot to care about as their number comes of age in state and local government. They inherit a long list of sticky issues: education, housing, mental health, public health, climate, and of course, workforce, which they are remaking in their own image. All of that and more as we continue our discussion of issues to watch in 2024 with the writers and editors of Governing.
TFIC takes you deeper into the stories that are shaping the future of state and local government.
To boldly go where no man has gone before.
You're not Buzz Lightyear.
I'm Siri.
And I'm Google.
And I am Alexa.
Alexa seems so smart. I think we'd have a lot to talk about.
Pew, pew.
From Governing and Government Technology, this is The Future in Context. With Ashley Silver, I'm Paul Taylor.
Paul, new legislative sessions have been gavelled open in many states across the nation. There are many bills in the works that track with the issues to watch compiled by the beat writers at Governing.
Last time out, that conversation began with an overview of what's ahead in state budgets and taxation, and the demands on public funding to mitigate poverty, the fentanyl crisis, and crime. You can find that episode earlier in your feed.
And our conversation continues in this episode with their takes on public health, mental health, energy and the environment, and more.
Now, just to do a quick reset as we begin, we are talking with Governing Editor Alan Greenblatt and his staff of writers, Carl Smith, Jared Bray, and Zena Hutton. Let's pick up that discussion with your exchange with Zena on education.
Zena, I recently read that at least 32 states offer some type of school choice program. So what have you seen regarding school choice options or concerns this year? And also, how have those topics funneled into other issues such as parental rights and book bans?
School choice is a really big deal. It's come up talking to my sources just broadly on the education story I've done and also for this. It kind of picked up speed with parental dissatisfaction around the pandemic, both because schools were closed and people were kind of forced to have their kids at home, but also because when the children return back to school, you're seeing kind of devastating test decline. Like reading levels were down and they're still pretty low. Though that dissatisfaction is used to encourage this school choice movement, so that parents can you can take your child to this private school. And it takes funds out of the public sector, out of public education. And that's on purpose. And, it depends, parents are divided. I think everyone is divided except for public school teachers who really are not, from what I've heard, are not very pleased with school choice. We're seeing parental choice primarily around LGBTQ rights, the usage of preferred pronouns, different from where you're assigned. We're also seeing it with the names that students ask to be called in school. There's a lot of parents have the right to decide what their children are called in school, how their children are addressed. And, it feeds also into the ongoing conversation about what material is allowed in schools, because a lot of the material being banned or coming up for these conversations about banning revolve around LGBTQ issues at different levels. So it's something that we're seeing a lot of in these conversations.
And I also wanted to touch a bit on media literacy in schools. I noticed that New Jersey and some other states have enacted bills focused on that. I just wanted to ask, just kind of pick your brain about why you think legislation like that might be critical and how it can impact the future of education in the years to come.
I absolutely am a huge proponent of media literacy. I think it's something that's really necessary because children spend an incredibly large amount of time consuming media, whether that's out of context on social media or on YouTube or just spending hours online. They're consuming a very large amount of content that previous generations simply didn't have access to. And these attempts at media literacy our media literacy legislation are trying to address kind of a gap because there's really nothing in place to help students understand, like when you read something on social media, how to take it. Especially with TikTok. TikTok is actually really infamous for how you are learning things from people who aren't really educators. So there's not a lot of conversations about what to do when your child is learning from a TikToker. And so the media literacy conversation is like really important because we're seeing Gen Z younger increasingly turn to the internet broadly for their sources, for their homework, for interpersonal conflict, for politics, for history. And they don't know how to check their facts. And so media literacy legislation is really trying to give students kind of an extra leg up to encourage them to question what they're consuming, to rethink how they're consuming. And it will help in the future because we're seeing more and more reliance on, well, like AI. AI is actually a big issue with education because a lot of students use it to kind of help write their papers and source their arguments. But if they can't recognize recognize issues with like the text that is generated, when they can't recognize hallucinations in the text, when they don't know how to talk about what they're consuming, what they're being told is a factual source, what comes out is documentation, in their assignments that just isn't correct. And it just builds a really bad foundation for, higher education for them in the future.
Yeah, and to kind of segue, I guess, into our next topic, which is mental illness. I know that there have been several pieces of legislation passed kind of to regulate how youth are consuming social media and, what age they can get on those platforms on. So, just kind of segueing into mental illness, which it has been an increase in cases across America. But of course, with that increase, there has to be funding to meet the increased demand for services. So, Jared, I know states are working to figure out, just where that funding will derive from while also battling workforce shortages. Can you speak to those conversations?
Sure. Yeah. I mean, you mentioned sort of the increase in mental health challenges across the U.S., which I think the pandemic sort of helped peel the lid off of a little bit. There's been a really sort of pronounced uptick in cases among young people, especially. So some states are pushing to have school-based mental health services or add mental health education to the school curricula. Maybe 20 states or so have done that in the last 5 or 6 years. But sort of the biggest push around this stuff lately has been the establishment of the 988 National Suicide Hotline. I forget what the exact name of it is, but it was passed by Congress that states could establish these things, but it's up to states to implement it. And so essentially, the biggest sort of funding they're doing is coming from a fee that goes on monthly phone bills, similar to the way 911 services are paid for. 8 states so far have passed these fees to fund 988, and so it funds the call centers themselves, but also the sort of crisis response teams. Those are expensive things, and obviously, folks are facing workforce challenges in every area of the public sector and private industry too. So it's sort of an ongoing struggle, but I think that's one of the more promising areas because it's sort of enabled by federal legislation, but states are sort of have their own leeway to establish as they see fit.
And I've seen a few articles on governing regarding Medicaid reform pertaining to mental health coverage, and then also some reforms needed to service, people having mental challenges within the prison system. Can you tell us more about those concerns a bit and how those are being addressed through legislation?
I can try. The thing I know most about is that like a lot of the ways that mental health intersects with the sort of public sector is like the way people deal with crisis response. And there's been these movements over the past few years to sort of take policing a little bit out of the sort of response to a lot of mental health issues. So, mental health is something that sort of intersects with a lot of the other things that policymakers are concerned about, from sort of housing to public safety, gun violence, and all types of things like this. And so people are trying to figure out ways to respond to people in mental health crises sort of in ways that make sense to help resolve the situations. But I think the bigger struggle is sort of the things you're talking about, which is sort of how to set up the sort of environment where mental health challenges are addressed before they reach crisis point. And that's something that I don't think a lot of people have figured out yet. They're sort of putting together various sort of structures in place to help people sort of identify those challenges earlier on and have support to sort of deal with them and things like that. But no one has sort of figured out the exact right formula for having a comprehensive solution to that.
So, Carl, mental health has certainly been a driver within health as a broader issue or policy issue. What are you seeing in that broader context? A sector of the economy that has been through the crisis of COVID and really its weaknesses laid bare through the pandemic, and now in a bit of a rebuilding stage. What does it look like when you talk to people proficient in the area?
In government, health is public health in many ways, which does relate to all the things you just mentioned. And as we've touched on a little bit, workforce is a giant problem there. People are leaving in rates comparable to what you're seeing in election administration and police. And workforce reports on government have found that these are some of the hardest jobs for them to fill. So that's a rebuilding issue. That's a big concern. And they're looking at ways to fill the gap, maybe more use of community health workers. Some states are wanting to be able to pay family members who deliver in-home care to their family members. So just trying to figure out ways to fill the gaps and at the same time make more funding available, maybe for pay raises or loan forgiveness or programs like that that can get them working. There was expanded Medicare coverage during the pandemic. That's gone. Unwinding that is still going to be a big priority in 2024. So a few states have gotten along on that, but there's a lot more work to do. And that, involves helping people find new coverage. And it also, in a way, is going to give opportunities for people to collect lessons learned that can help improve Medicare and Medicaid in the future. Some states are looking at, and you talk about healthcare costs, some are looking at, can they have more authority over those costs and how they are set, and kind of have a place at the table along with healthcare systems and private equity partners regarding pay schedules. Similarly, prescription drug prices are a big concern, and folks are trying to see what they can do about spread pricing, where it's the role there is a prescription drug manager for a provider can charge more for the medication than it actually costs, and so they're trying to get in the way of that and help that be less of a problem. Housing is a healthcare problem, and so there are Medicaid provisions for social needs that are being used to cover housing. So there'll be look at how can they be integrated into housing programs at state level. We had big upgrade in public health data systems during the pandemic, and some of the funding for those has gone down, but there's still a continued push for improving both state level data and making it more interoperable with other states, and maybe toward soft in the future, but there's still a desire for a national data system, because as we saw during the pandemic, you can say your data is Kentucky only, but COVID doesn't know when it crosses a border, and it really is important to be able to know what's happening elsewhere. We haven't yet really talked about abortion, but interestingly, along that line has come, or in the same way has come, increased attention on availability of contraception. So more attention to making sure that that's available. Whereas in a few states, the abortion laws have created questions about what kind of contraception should be available. Plan B or morning after pills are something that are going to be pushed against in states with very, very strict abortion laws. And this is an embarrassing one for America. We have the worst maternal mortality rate among developing countries. So there is attention on trying to do something about that. It's 3 times worse for Black women, which is just an inexcusable thing. States are going to be asked starting this year to report to CDC. Maybe that'll bring more attention to what's being done, what's not being done. And then there's also been an increase in sexually transmitted diseases, syphilis in particular. So there's going to be more attention to screening for those, and definitely making sure that you catch those in pregnant women to prevent any kind of problem passing to the offspring. I guess one last thing. We've known ever since Rachel Carson that we've got chemicals in the environment that accumulate in the soil, in the water, in the food chain, and then ultimately in breast milk. It's been really, really hard to regulate them, but this category of chemicals, PFAS, things that are used in water-resistant clothing, nonstick pans, et cetera, now called forever chemicals. States have been moving to restrict those or ban, and that's an area where a long-standing problem in health is getting a little bit of progress. We'll see how long it takes to move on to other things that are also in breast milk and shouldn't be being passed along to unborn children. Actually, they do go pass through the umbilical cord while the fetus is developing, which is a problem because that means a part per trillion exposure can be a problem. And that a part per trillion is 1,000th of a part per billion. A shooter marble that is 1/2 inch in diameter is 1/1000th of Earth. So 1/10000000th is 1,000th of that. So these are chemicals that can have a big effect at very, very small exposure levels.
I'm not a math major, but that sounds important. Your last point really is a good segue into talking some about the environment and climate. COP28 just concluded with not the most optimistic results, of reluctance to address the electrification in the automotive market. What do you make of where we are with climate and energy, and what can be done domestically?
Well, I mean, obviously it's very complex. I mean, we had the hottest year on record. We're only 1 degree Celsius away from the 1.5 number that was considered to be a potential tipping point where the already existing effects of warming compound on each other and we begin to lose control. Climate could change forever, potentially. Well, these are all things we don't know for sure, but that's not good. There were more billion-dollar climate and weather disasters in 2023 than ever before. And COP28, climate scientists seem to consider it pretty much a failure, largely because no real commitment to get rid of fossil fuels, which are what are continuing to make things worse. But interestingly, in some ways, states are one of the most hopeful places for some kind of progress. They don't have to wait for the federal government to fight out what they're willing to agree upon or not agree upon. Unfortunately, at this point, at least, there's still the $369 billion in the Inflation Reduction Act. Now, a lot of the last year was just working. It's very big, very complex bill. It takes a lot of programs to spend $369 billion. And a lot of last year was devoted to working out, first getting comments on the programs, working out guidelines for them, and beginning to issue requests for proposals. So it's not like huge amounts of that money have already gone out. They're starting to. And I just want to mention something I found that I really like. There's the Sabin Center for Climate Law has a tracker that I think would be of interest to folks in state or local government, which by section, you can search many ways, but even section by section of the Inflation Reduction Act, you can see what government action has been taken. So did they ask for comment on this? Have they announced that proposals are now being accepted, et cetera, et cetera? You can track all of that. And it's still in progress. But there are some things that have happened. I guess one big thing and a complex thing that'll play out this year is they announced 16 states that will get $7 billion over 8 to 12 years now coming right now for 7 regional hydrogen hubs. And there's a lot to do this year. This whole 2024 is just going to be doing plans for them. But there's a lot going on around those because of the huge tax incentives, tax credits rather, that come with that. There's a potential 100 billion in tax credits associated with hydrogen production. But the size of the credit is directly related, at least at present, to a sort of formula, you might call it, for how green the hydrogen is and how few emissions are created by the production of the energy used to make the hydrogen, and also whether or not the clean energy involved is new to the grid, or whether you're drawing on something that isn't already there. And there's a lot of argument, some folks are saying, well, we should get the best credit even if we're not the cleanest, because we can't get the cleanest ramped up fast enough, and then we'll change it after we get started. But as I've heard more than one person say, no one's really enthusiastic about having a credit reduced once it's been granted. At the side of that also, some of the folks in the nuclear energy sphere are saying we should get that credit too. So it's a controversial thing. It's not expected to be any kind of decision in the near future, but it has quite a bit to do with how that all plays out. It's been said that we need to build twice as much transmission capacity at twice the rate in order to achieve the real benefits possible through the Inflation Reduction Act. If we don't speed it up, we could lose 80%. And transmission capacity is something that requires state-to-state cooperation, regional cooperation. States are looking at their laws regarding permitting for these things, for land use. It sort of plays into grid planning also at state and regional levels. And it's going to take a lot. But at the same time, there's enough renewable energy already waiting to get on the grid to replace every generator in existence right now twice. So we've got huge capacity waiting to come online. The permitting for that has been slowed down. That supposedly is sorted out. That might begin to move faster. So it only adds to the urgency for having the transmission there. So that's going to be a big, complex thing that has to get sorted out. It won't all happen this year.
It is a very complicated world where everything is related to everything else. Thank you for that. And we will have a link to that tracker you mentioned in the show notes at tfic.tech. Jared, let's bring you back into the conversation on housing. Also a public health issue, but it is more than that. There's shortages everywhere, urban and rural, especially affordable housing. Is there time, money, and land enough for communities to build their way out of this problem?
This is one of those things that's been building for years and years and years. The housing issue, it typically was sort of seen as something that cities had to deal with on their own. Local land use rules are the kinds of things that control a lot of what gets built and where it gets built. And so you've seen a lot of cities experiment with things like zoning reforms, parking reforms, allowing accessory dwelling units, things like that over the last decade or so. More recently, states have gotten in on this as well, because like you said, there's shortages in rural areas. It's not just a big city issue, the lack of affordable housing. It's also something that's happening all over the country. And so you've seen states, including not states that are known, typically as blue states like Utah and Montana and things like that, start to pass laws that are meant to make permitting easier for housing or allow additional units on areas that are zoned for single family housing. A lot of efforts. What it's added up to is still sort of an open question. There's the problem still gets worse every year. So despite all the policy experimentation, no one has quite cracked the code on that yet. I think you'll continue to see states focus on this a little bit more. The Biden administration had sort of run on the idea that it was going to sort of do a lot more on housing too, but a lot of that really hasn't come home yet.
Very good. Thank you for that. Ashley, why don't you and Zena take us home?
So, Zena, we are back on workforce. I know you mentioned it a little bit earlier in relation to AI, but can you give us an update on workforce changes this year? Any digression or progression from last year? And what are the central workforce challenges out there currently?
I think one of the biggest, like, starting from the end, one of the biggest workforce challenges that we're seeing is that public sector workforce is trying to bring in people to replenish the workforce, because we're seeing a lot of older employees kind of move out. They're retiring. They're moving to the private sector. They're moving to other departments, and so you have like these gaps left behind that public sector HR is trying to fill with kind of like underrepresented groups, trying to fill with Gen Z. Gen Z is a big focus for public sector workforce, because the older level of Gen Z is in their mid-20s right now. So these are people kind of primed to enter into the public sector workforce, because we've seen documentation that Gen Z really cares. They really care about the world they live in and politics. And so they're trying really hard to bring in these groups. One of the things that they're facing, though, is that a lot of these people that are kind of being excluded from particularly the public sector workforce, they're being left out because they don't have necessarily 4-year degrees, or they don't have all of that experience. And so they're kind of working to reshape the hiring process, not just with the usage of AI in terms of the hiring process, but in terms of what the job application websites look like, what the job requirements look like. They're prioritizing, or increasingly prioritizing, skills-based hiring. They're not downgrading degrees, but they're shifting the priority. So if you are doing public bus driving, you're not necessarily somebody that needs a 4-year degree. You need a specific license, but you probably don't need a degree. And so they've found, in California and a couple of other places, they've reassessed their jobs just to see what they're asking for, and if they're asking for too much in a way that keeps kind of qualified and interested people from getting a shot at working in the public sector workforce.
As far as those changes that you just described, have you seen any successes with that? The sources that you're talking to kind of diverging to a different path as far as hiring. Has there been success with it?
I think the biggest success that I've seen so far comes from California. CalHR is kind of actively trying to level up their existing hiring practices for the public sector, and so they were one of the states to go through and change the requirements for some of their jobs. And they're already seeing an increase in applicants and qualified applicants, once they've shifted requirements or removed the 4-year degree barrier. So we're seeing an increase of like thousands of new people who had previously just excluded themselves or felt excluded by existing public sector workforce requirements, and they're applying now.
Moving to something that certainly can be included in that workforce conversation is pensions. So, in Florida, earlier this year, the governor created an expanded pension benefit known as the Deferred Retirement Option Program. And this would allow career government workers and educators to draw pensions while continuing to work for 8 to 10 years. But it would cost the state an additional $350 million annually, which is a large price tag. So I was wondering if you could share some other cases of pension overhauls this year, how they've impacted states, and how
Rather
interest
than
rates could be
states being
impacted.
really hyper concerned about running out of funds, what they've been focusing on is preparing for the future, because they feel as though they're in stasis. So there are some states that are struggling. I think Illinois was one. New Jersey came up repeatedly, and these are states that are dealing with gaps, and they're kind of meeting them with the tools they've always been trying. I think that's the recurring note across these conversations I've been having, is that it's, even though they're in stasis, what's happening is that they're trying to make up for these gaps in pension debt. and funding, because a lot of states, I think 21 was what David Drain from Pew told me. 21 states are underfunded at various levels. Like there's probably some states that are way better off than others, and so they're always trying to utilize their existing tools, whether that's making cuts or changing where they invest. And so that's really what we're seeing. We're seeing a lot of states kind of acknowledge that they're in a sense of stasis, not necessarily stability, but stasis, and trying to keep their pensions just stable as they can, to account for future instabilities with investments, financial crises, and other issues.
Moving into next year and the following years, how do you think pensions will be impacted then? Do you think that they'll move to another strategy, or do you think like the stability aspect
I
is
think
still
what we're
something they'll
going
be
to see,
concentrating
because
on
it
into
came up
next year?
when I was doing research and in conversations with my sources, was just the concept of stress testing. That is something that more and more states are relying on, just, even when things seem fine, in order to make sure that they have things in place just in case. Like, so they're testing whether, riskier ventures, a new private equity investment or a new real estate investment could work. Like, what would happen if the stock market goes through something incredibly terrible? Like, they're testing to make sure that they can handle the pressure. And I think we're going to see more of that. We're also in the situation where there are really underfunded states. We're going to see more cuts, which have really negative impacts on kind of like classroom sizes. That's one of the things that came up. Classroom sizes are impacted, and cuts to healthcare might be possible, but it depends on what the state's approach to their debt, to their gaps are. It will depend on the state.
Zena has the last word as we run down the issues to watch for 2024. If you missed the first episode in this two-parter, it awaits you just slightly earlier in your feed. Zena Hutton, Carl Smith, Jared Bray are all part of Governing, as is its new editor, Alan Greenblatt. It was good to have them all with us for this conversation. They are all, by extension, part of our editorial and production team, as are Aragon Item, Zoe Manzanotti, and Kaylee Tedrow. Our executive editor is Noel Nell. Our editor-in-chief is Kathleen Robinette. And finally, a word of thanks and goodbye to Governing's editor emeritus, Todd Newcomb, longtime friend and colleague, and we wish him the very best in his next chapter. For Ashley Silver, I'm Paul Taylor. Thanks for listening. And stay in touch with the show at tfic.tech.